folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
I'm
Bob.
trying to have better posture than Brad today.
Posture.
So the question today is, can my knee arthritis get better? And again, I'm not talking about my knee arthritis. I'm talking about your knee arthritis. And we'll try to answer that question today.
That's right.
So this is a typical scenario that I would see in the clinic. A person would come in 50, 60, 70 years old, and they were having some knee pain, and it's not going away. So they went and saw their doctor, and he orders or she orders some type of imaging test, maybe x-rays, MRI, CAT scan.
Sure.
Lo and behold, they find something.
Yeah.
Like there's some big deterioration that went on.
Right. They'll show you the gap on one side or the other, and it's narrowing, and that
Yep.
means the cartilage is wearing out. So can you get it back? Can you fix it?
Well, now the patient's going to go, well, now we know what is causing my pain. So then they try injections and they try medications and maybe even surgery. When the fact is, no one's told them the truth, Brad. The fact is, if they took a scan of the other knee, they might find out it's even worse. And yet they may not have any pain in that knee.
Right.
And we see this all the time. This is coming out in every joint, shoulder, hip,
Yeah.
knee. Gotta think about what
Figure out where you're pointing.
Yeah. And in all these cases, they'll do x-rays of one side versus the other side. And the one side might be look worse. And we've seen this many times in patients, but they're not having any pain.
So you do surgery on the one that looks worse or the one that hurts worse?
Right. So what's causing your knee pain? Is it the deterioration? Yeah, maybe affecting it, but really, quite often it might be your daily habits or weakness in the knee or tightness in the knee.
Sure.
So we want to make sure that try some therapy first,
Right.
change these things, and then see if you get any relief from it.
Right. And one way or another, if you have tightness or you're walking in a fashion that irritates it, you want to correct those things before you'd have surgery anyways, because
Right.
the results of the surgery are going to be much better, faster, et cetera. So
Yeah, so if your knee is stronger, it's going to do better with surgery.
Right.
If it's moving better, it's going to do better with surgery.
Yep.
So there's nothing to lose here.
Right.
And everything to gain. So 5 concerns people bring up about their knee arthritis.
Okay.
Let's go with
Yep.
number 1. It's going to continue to get worse. So I might as well have surgery because it's going to just get bad.
Right. Right. It's like the rust is just, if you think of the cartilage as
It's wearing out.
as rust, is going to rust and get worse, but not necessarily the case.
No, studies have shown now that they can remain the same or they can even get a little better. And again, I'm going to bring up my wife as an example. 3 years ago, she had a flare-up of her knee joint to the point where she was on crutches, couldn't even walk without them. That was over 3 years ago. She's now back to running. Like I was telling Brad earlier, she ran around the lake this morning, and that's 3.7 miles.
Good.
So,
Is she running away from you?
oh, I'm sure that helps. There's some motivation there. So, the second thing we hear a lot is people say, well, you know what? I wore out my knees due to years of doing fill in the blank. A lot of times it's milking cows.
Right.
Heard that a
Yeah.
lot?
We did a lot of, work in the rural
Yeah.
areas, and, you're kneeling on concrete, that's an understandable
Right.
concern.
But it could be running, hiking, roofing. And the fact is that's usually not true. The fact is the more you're moving your joint and using your joint, the better it's going to be. The worst joints tend to be the people who are inactive.
Sure.
Like if you sit all day, your joints are going to tend to be worse than if you run or hike or something like that.
And we're talking about within reason. There are some activities that put a tremendous amount of stress on the knee, and maybe that's understandable, but,
Yeah, there's always exceptions to the rule. So number 3, I don't want to make my arthritis worse, so I'm going to rest my knee. Well, that's not how knees work. Unfortunately, beyond resting the knee for maybe a day or two
Sure.
is fine. But joints love movement. The more movement you get, the more synovial fluid you get
Yep.
built up.
More circulation
More-
within the
yeah,
joint.
which is kind of the
Lubrication.
right.
Exactly. Again, within reason, but we do want to, and we have exercises that are specifically for people who have sore arthritic knees. Obviously, you're not going to put 100 pounds of weight on your shoulders and do squats. We're talking about range of motion and exercises that are
Yes.
appropriate for a
And
sore
the
knee.
exception would be is if your knee arthritis has advanced so far that it's just, you've had these patients, Brad, where
You can hear it. You
Yeah.
can clearly feel the joint.
and all you do is move it a little.
Yeah,
and it's
and
time.
everything is rougher than rough. And yeah, that is clearly an
That
exception.
was my grandpa. He didn't have replacement of the hip, and he should have.
Mm-hmm.
And he got to the point where he couldn't walk anymore, and there was nothing he could do. I mean, it was just
Yeah.
terrible. So number 4, my mom had arthritis, and she suffered it with it for years. So that's going to happen to me. Well, some of the arthritis do have an inherited factor
Genetic
to it.
component?
Yeah. But it's amazing how the body can adapt if you do make the changes that we talked about,
Sure.
range of motion, strengthening. So you can overcome your genetics if there are some.
Right.
And another thing is arthritis is really common. If the fact that your parents had it, that doesn't mean anything because just about everybody gets arthritis.
Yeah, as they age, and there's a number of components as far as some people think diet has something to do with it.
Right.
which-
Inflammatory foods.
Right.
Yeah.
Exactly.
Good point, Brad. Number 5, I'm going to eventually need a knee replacement, so might as well do it Now, that's true, especially if your health is a little bit questionable and you're worried that maybe 5 years from now you won't be able to tolerate the surgery.
Right. Right.
But if possible and you're in decent health, we usually like to hold off as long as possible so
Right.
that the knee replacement lasts maybe 15, 20 years. So if you're only in your 40s or 50s, you might have to get another one,
And it's
as you get
harder to do a revision or another one. Maybe in 20 years from now, maybe they'll have it figured out and they'll have a better
Right.
way to do it. But still, they have to remove the old hardware, put new stuff in. It gives you the doctors less to work with. It's definitely a discussion you want to have with your surgeon,
Right.
and they will. And again, if you're not happy with your doctor, your surgeon, because you just don't have a good rapport, it might be a good idea to get a second opinion.
I think in most cases you should, because they'll give you a different perspective, and it's an important surgery, a major surgery. So, and 15, 20 years from now, it's going to be harder to tolerate a surgery. I can tell you that already.
Sure, right.
If you're in your 50s and suddenly you're in your 70s, take it from 2 people that know.
And if you're our age, you realize that every decade you typically this is more challenging than when
Yeah.
you're younger,
Yeah.
one way or another.
All right, we've gone on long enough,
We
Brad.
continue to babble again.
All right, thanks for everybody for watching.
Be careful with those knees.